heterotopic part, and that is your force of contraction or preload is proportional to the change of the length up to a physiological limit or up to a limit. After that, that will happen. Why it happens? Due to the overlapping of actin and myosin up to a limit. If it is limit cross jodi korlo, then actin myosin contact asbe na. So that will fail. So that is your heterotopic. And one is called myogenic control was that homotropic, right? That was controlled by the calcium handling. এই যে এই পয়েন্টস গুলো এইগুলো প্রচুর হেল্প করবে whenever you are in pharmacology as well as pathology as well as when you are in general medicines, right? So these things are very important. Now my second question is that if suppose you have a set point that 120/80, this is your blood pressure, and now suddenly it comes as your pressure becomes 180/100, right? So set point changes. So what mechanism it will act? Hey, bolo. If your blood pressure increase to some extent for a short period of time, then what mechanism will helpful to control or to keep the set point at your point that is 120/180. It's normal BP, your normal BP is 120/80 is fixed. Now it is 180/100. Due to many reasons are there, due to any reasons you suddenly your BP increases. Then which system will come into a play into action to reverse back to your normal pressure? This is 180, 120/. Baroreceptor reflex. How it acts? Very good. First answer is very good. How it acts? Where are the baroreceptors are present? Baroreceptors location. Black color. What are the locations of baroreceptors? Next. What are the locations of baroreceptors? All present in the common carotid artery. Next. Any idea? No idea. Carotid body and aortic body. Remember all the third one, that is the surface of the myocardium. That is beyond your scope, but remember that the three places of baroreceptors are there. One is aortic body, carotid body, and other ones are lots of baroreceptors are present over the surface of the heart, right? That is also important. Now you tell me how it acts to decrease your BP. KLM? No. First of all, say that why baroreceptors are stimulated. What are the nerves that stimulated? And then go to the central nervous system. Glossopharyngeal carry the which one? Carotid body. And then vagus nerve come for the aortic body, right? Absolutely right. Then it stretching effect, right? If BP is increased, then the walls of that vessels will be stretched, and that is stimulated. That stimulation means nerve endings stimulated by the glossopharyngeal, and nerve endings of the vagus nerve will be stimulated. Then it goes to the NNM na. NTS, that is nucleus of tractus solitarius. Then what will happen? শুনে নে যা বলছি ক্লাসেই হবে তৈরি, নাহলে কিচ্ছু করতে পারবি না। CVLL by the releasing of glutamate. GABA is a inhibitory. Then from the CVLL, that is just caudal ventrolateral media, it releases the GABA, and that inhibits the RVML, that is rostral ventrolateral medulla, right? And these rostral part is connected to the sympathetic chain, that is lateral spinal column, that will come into the sympathetic. So, that is decreased, right. So, if sympathetic stimulation is decreased, that means what? Your cardiac output, your heart rate will all decrease, also blood pressure, and that is our aim, right. That will act up to a certain point. If it is persistent, then the baroreceptor reset the set point, that present at that level, so that any continuous hypertensive patient, there is no role of baroreceptor reflex, right. So, this is important part. And if you, not only that, it coming from the NTS, it also activates the nucleus ambiguous and dorsal medulla nucleus of the vagus. That is a parasympathetic component there. So, there in the brain medulla, there are 5 nucleus I have explained, 5. With this one, you have to remember after whole throughout life that that is a control of your chemoreceptor as well as baroreceptors, right. So, now that also stimulated, and if parasympathetic stimulation is there, then it automatically heart rate, cardiac output, BP will be low. And you already know that how the parasympathetic stimulation helps to decrease the heart rate, cardiac output. That is your M2 receptors are there, sit down all. So, M2 receptors are there, and one important thing for M2 receptor for your question may come, that parasympathetic effect for the ventricular and atrial myocardium is less than the nodal tissue. Explanation? Ki bollam? Je parasympathetic effect of the atrial or ventricular myocardium is less pronounced than the nodal tissue. Answer? Yes, yes. So, much more concentrated M2 receptors are in the nodal tissue. Very, very less amount of receptors are there in the myocardium, right. So, today your last part, that is your neural control already gone. Neural control means 3 controls are there, so sympathetic, parasympathetic and your medullary control, right. Medullary control we just explains in this way. তুই যদি ওই ছবিটাই আঁকিস মনে কর, ছোট্ট করে একটা ছবি আঁকলে একটা মেডালা একটা ইন্ডিকেট করলি নিউক্লিয়াস, তুই কি লিখলি আমরা দেখবই না, অনেক টিচাররা এটা করে। So, if you understand this one, the baroreceptor signal glossopharyngeal and vagus is coming, and then it stimulates the nucleus tractus salutatorius, and then it's activates by the releasing the glutamate into the caudal part, and then GABA into the RBML, then it inactivates the sympathetic chain. Beauty. That will no need of any memorizations. That is the important part. So, to some extent to understand the medicine, you have to understand this type of. Otherwise, during your final MBBS classes, you can't understand the pathological conditions. You have to first understand the physiological conditions, right. So, in this pattern, last part is just your humoral, right. You can say itself that what are the humoral means hormones are responsible for your control of your heartbeats or cardiac cycle. কি বল একটা একটা করে নাম বলো। একটা হচ্ছে catecholamines, very good, that is the norepinephrine and the epinephrine, and we already know that how it acts, it is a G protein coupled receptors. So, it activates the G protein if it is non-adrenaline epinephrine, and then it adenylyl cyclase activity, cyclic AMP will increase, protein kinase will increase, thus phosphorylates the sodium voltage gated sodium channels, as well as it phosphorylates L type calcium channels, right, very good. So, L type calcium channel means dipyridine model or dipyridine type of receptor, dihydropyridine type of receptors, that is L type channels from through which lots of calcium influx happens. So, that is phosphorylation happens. So, the rate of calcium NT will increase. Not only that, you already know that is the sarca and the pamka. In the sarca, there is a connected of the phospholamban, which is normally inhibitory property is there. If it is phosphorylates, that inhibitory part will gone, and so that calcium can enter into the sarcoplasmic reticulum, so that the availability of the calcium for the next contraction will increase, right. That is why it is ultimately that is also part of the staircase effect and the Bordich effect also called, and that is also happens for the your contraction, force of contractions. inotropic effect, dromotropic effect, barotropic effect, and also lucitropic effect. এই যে lucitropic effect এর explanation হবে ওই phospholamban দিয়ে, because that is important for your relaxation also, right? For the relaxation, potassium থেকে বেরিয়ে যাওয়া যেমন আয়ন হবে, similarly sodium calcium exchanger is there, right? Sodium calcium exchanger is already explained in the previous class nicely. Now your hormones like norepinephrine and epinephrine is helpful for your number 1. Number 2 hormone or number 2 parts, RAS mechanism, very good. That is your bolo Renin-Angiotensin-Aldosterone System. This is important in whole your physiological, pathological medicine, right? But when it acts, how it acts? Why renin will release? Blood pressure na. Basically, ki hoy, it happens when in the your blood vessel, when the blood volume is less, right? Then in the kidney there will be less perfusion. When the less perfusion is there, juxtaglomerular cells will be stimulated, right? That is the part. When blood volume in the vessels is less, then the perfusion in the kidney will be less, then your renin will be secreted by the juxtaglomerular cell when it is stimulated. So renin is secreted from the juxtaglomerular cell, right? If renal system in my part, then I will teach everything. So juxtaglomerular cells are there from where renin is released, right? Now কে বলবে তারপর কি হবে? অ্যান্টিনোসিনোজেনটা কোথা থেকে এলো? লিভার থেকে. So that is important. So that is your liver. It's come the angiotensinogen, and this renin acts on two formation of angio 1. Then yes, that is your, suppose this is your lungs, and then it is ACE, that is converting enzyme, right? That will act, and then angiotensin 2. Now, what are the functions of angiotensin 2? Vasoconstriction, number 1, আস্তে আস্তে করে. Then রিলিজ করবে. শুনে নাও, অ্যাঞ্জিওটেনসিনের 2 ফার্স্ট অ্যান্ড ফোরমোস্ট ইম্পর্টেন্ট কাজ হচ্ছে মায়োকার্ডিয়ামের উপর. That increases the force of contraction, number 1. Number 2, vasoconstrictions. Number 3, it will activate the adrenal cortex to release the aldosterone. So remember, for RAS, aldosterone is a big role, and this aldosterone has a role of what? Sodium and water reabsorption in the collecting tubules and the distal tubules also. So what will happen? Ultimately, fluid absorption will be there on, resorption is there on, so that blood volume can be increased ultimately. So if it is low blood BP, blood volume, then the RAS system will be activated. Due to the low perfusion of the kidney, juxtaglomerular cells will be activated, and then only renin will release. And after the release of renin, it converts the angiotensinogen to angiotensin 1, and then from the lungs, when it passes to the pulmonary capillaries, এটা পুরোটাই ব্লাডে যাচ্ছে. When it's coming communications with the angiotensin converting enzymes, that is only the present in the lungs. এটা কিন্তু ভাইবাতে খুবই জিজ্ঞেস করা হয়, this part. And then it's come to the angiotensin 2 and angiotensin 1 and then angiotensin 2. Angiotensin main function is to the myocardium, to the force of contraction, cardiac output increase, right? Number 2, vasoconstriction. Number 3 is your what? Aldosterone secretions, right? These things are happening to ultimately it will cause the ultimate effect to increase the blood volume and blood pressure. Simple. So RAS system is also helpful for cardiac activity or cardiac cycle to increasing the cardiac output by blood pressure increasing by the blood pressure and blood volume. Now other hormone, huh? Atrial natriuretic factor, bah, very good. Chalo dekhi. So atrial natriuretic factor, right? So atria, when it is released, so this is your heart. This is your heart. It is your এখান থেকে চলে গেছে পালমোনারি, এখান থেকে চলে গেছে ধর aortic arch. So this is your inferior vena cava, superior vena cava, right? So in these fashions, this is your pulmonary veins. So now the atria and the ventricles are there. This is your ventricular septum. Simply. Now atrial natriuretic factor, ANP, atrial natriuretic factor. So নামটাই বলে দেবে সবকিছু কি করছে. So but when it is released, not only atrial natriuretic factor, that is ANP, there is also a BNP, right? That is a ANP and also BNP. What is the BNP? No, that is a B type natriuretic factor, not brain, right? That is a B type. এই যে ব্রেন বললো ও কিন্তু ভুল বলেনি. So that's why I always ask to read proper book, right? এটা কিছু ছোট্ট ক্ষুদ্র বইরা এখানে লিখে দিচ্ছে ব্রেন. No, not at all, no role of at all brain. I will tell you what is this type. This is very important. This BNP is very important. And nowadays in each and every cardiological center do the everyday test is this, right? That is called, that test in the lab is done by N-terminal pro-BNP, right? Pro-BNP. এই টেস্টটা করতে দেওয়ার উদ্দেশ্য হচ্ছে to understand the features of whether patient is suffering from any impending heart failure or already heart failure in the back phase, right? So whenever heart failure happening or not, sometimes it cannot be implicated by your clinical scenario, but it may come. But problem is that if any inflammation is there, its value can be raised. There is a range is there, but there is no inflammation at all, but it is increasing so much, that is 900, it is a nanogram, 900, 1000, 3000, 4000, that means without any infections or any renal problem. If it is renal problem also, that also can increase. So that is a fallacy. But if একটা renal patient-এর তার BNP ছিল 1000, right? তার দেখা গেল 3-4 বছর পরে তার বিএনপি দেখা যাচ্ছে 5000, তাহলে দ্যাট মিনস নট ডিউ টু দ্য রেনাল কজ, ডিউ টু সাম কার্ডিয়াক কজ ইজ দেয়ার, অ্যান্ড দ্যাট ইজ এন টার্মিনাল প্রো বিএনপি টেস্ট. বিএনপি মিনস বি টাইপ natriuretic protein or factor, right? So peptides. So atrial natriuretic peptides. When it is released, when it is stretch, when it will stretch, কখন এটা স্ট্রেচ করবে? when the venous return will increase. When the venous return will increase, that will stretch. এখানে প্রচুর ব্লাড চলে এলো, রাইট? এখানে ব্লাড চলে এলে কি হবে? that will ultimately increase the end diastolic volume. That is ultimately your venous return, then your preload will increase. So that will be problematic to pump the blood to some extent. So that is release the ANP. Now how ANP acts? কে বলতে পারবে? দেখ, ANPর প্রথম যে ফাংশনটা হচ্ছে that inhibits the secretion of the renin. তাহলে রেনিন কি করছিল এতক্ষণ ধরে? বাড়াচ্ছিল, তাহলে কমিয়ে দেবে। এটা ফার্স্ট ফাংশন, রাইট? অ্যান্ড অলসো অ্যাট্রিয়াল নাট্রিউরেটিক, এই যে নাট্রিউরেটিক কথাটা বলছে, দ্যাট মিনস অলসো হোয়াট? ইট ইনক্রিজেস দ্য কি সোডিয়াম। কিভাবে হবে? তাহলে রিঅ্যাবজর্পশন কমাতে হবে, তবে তো সেটাই মানে ইউরিন দিয়ে সেটা কিন্তু বেরোবে। হ্যাঁ, অ্যালডোস্টেরনকে কমিয়ে দেবে, বন্ধ করবে না, কমিয়ে দেবে, রাইট? সো অ্যালডোস্টেরনের কিন্তু কতগুলো বাজে ইফেক্ট আছে হার্টের ওপর, দ্যাট ইজ কজিং দ্য রিমডেলিং অফ দ্য হার্ট or cardiac myopathy. So to some extent, when a large number of days patient is suffering from hypertension, then anti-aldosterone receptors blocking, that is, sorry, anti-aldosterone drugs are used. You will taught in the your pharmacology classes. So remember that one of the bad property of the aldosterone is that may cause the remodeling of the heart. Remodeling of the heart means that can increase hypertrophy, etc. That is not the ideal target to us. যে একটা হার্টকে একটু প্রেশার বেড়ে গেল, নিয়ে সেখান থেকে মায়োকার্ডিয়াল কার্ডিয়াক মায়োপ্যাথি হচ্ছে, দ্যাট কার্ডিয়াক হাইপারট্রফি হচ্ছে, দ্যাট মে কজড বাই দ্য aldosterone itself. So atrial natriuretic factor decreases the aldosterone level. Number 2, and number 3 itself it helps for the what? Vasodilatations, right? So তিনটে ফাংশন এটা কাজ করছে। এই যে বিএনপি মানে বেন টাইপ, এটা 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 কোথা থেকে বেরোয়? এটা কোথা থেকে বেরোয়? হ্যাঁ বল। হ্যাঁ, না না, বেন থেকে তো বেরোই না, দ্যাট ইজ ভেন্ট্রিকেল। That is ventricle. B type natriuretic peptide, right? So BNP and ANP in this way. So renin ke jodi ami bujhte pari tale ami ANP keo bujhe jabo. If we understand the renin how it acts, the renin acts only when your perfusion of the kidney is less, so your juxtaglomeralular cells will be stimulated to release the renin. Then angiotensinogen coming from the liver, it activates on the renin and then converting into angiotensin 1. When it passes to the pulmonary capillaries, then it come into contact with the ACE, that is angiotensin converting enzyme. That enzyme converts the angiotensin 1 to angiotensin 1 to angiotensin 2, and this angiotensin 2 itself has lots of function. First function is your directly acts on myocardium to increase the force of contraction and also cardiac output, and also it also helps to key vasoconstrictions. Also it releases the adrenal cortex to aldosterone, and what is the function of aldosterone? You already know that aldosterone acts on the distal tubules to sodium absorption, and sodium also takes water, so that reabsorption going on, so volume will be decreased. ANP will be thus reverse. ANP decreases the renin release. ANP decreases the renin. It is obvious if it is preload venous return is increased, then how the renal perfusion happens? Overperfusion will be there, right? So in that case, juxtaglomerular cell will not be stimulated. Juxtaglomerular cell only stimulates when renal perfusion is less. So that's why this is the less part of the renin will occur, and renin e ja ja korchilo sobgulo korbe na. That is our target. So the contraction happens quite nicely. বোঝা যাচ্ছে? So this is happens for your hormonal. আর কি হরমোন আছে? Glucocorticoid. Very good, very good. Glucocorticoid. How glucocorticoids acts? How glucocorticoids acts for increase our contractility, heart rate, etc. কে বলতে পারবে? বলো। অনেকগুলো কারণ আছে, আমি 3-4টে বলবো যতগুলো আমার মনে পড়ছে এখন, but there are lots of causes are there, lots of points are there how the glucocorticoid helps. Basically those are interrelated, those points are interrelated. Anyone guess? So first guess, you have to know already in the biochemistry that glucocorticoids helps to increase the glucose. So that's why the supply of glucose and ATP will be very much important for the myocardial contraction. That is helpful, number 1. Number 2, this increases the responsiveness of the noradrenaline and adrenaline hormones, or epinephrine and norepinephrine hormones, to act into the beta 1 receptors, right? Number 2. Number 3, it increases the sensitivity of the beta 1 receptors at the level of cell, right? That is your pacemaking cells as well as your contractile cells. There is sensitivity of the receptors to the sensitivity to the norepinephrine epinephrine increase. তাহলে 3টে কজ এখনই দিলাম বলে, একটা কি বললাম যে গ্লুকোজ বাড়ায়, একটা বললাম রেসপন্সিভনেস অফ দ্য norepinephrine and epinephrine increase, and থার্ড কি বললাম যে it increases the sensitivity of the beta 1 receptor that is present in pacemaking cells. Already you know that beta 1 receptor, and you already know that beta 1 receptor is G protein coupled receptors are there, right? But M2 receptor, it is G inhibitory proteins are there, right? So that's why in case of parasympathetic stimulation, it is functions of cyclic AMP decrease, protein kinase, no action, though reverse action will be there. only function of that parasympathetic effect or G inhibitory protein activity that increases the potassium release. Potassium cell ke release korte help kore. That is the important point. So that's why your hormonal part of the glucocorticoid function ei tinte mone rakhলে enough. ঠিক আছে, কি কি বললাম? Glucose supply, sensitivity of the beta 1 receptor, and also responsiveness of the norepinephrine epinephrine will increase by the glucocorticoids hormones or the glucocorticoids. Ar ki hormone? Thyroid hormone. Very good. T3 and T4. T3 is more active than the T4. How it acts? Because in cardiomyocyte, that is cardiac cells, each has the thyroid receptors are there. And after combining with this receptor, suppose this is your pacemaking cells, right? You know already that in the pacemaking cell there is a funny sodium leaky channels are there. Already, always it is going inside, right? Not only that, there is receptors for the T3 and T4 receptor, most of the cases T3, and that's bind with that and enters into the cell. And in the cell, there is a genetic imprinting or genetic expression, that is gene expression is there. And that gene expression, it activates the heart rate as well as increase the cardiac output. So it acts, I am not going details because this is absolutely biochemistry class. So in case of biochemistry, if you interested by your own, after doing all the things, you can ask me in my free time how it acts. Anyway, you have to understand that receptors enters into the cells after the binding with this one, and after binding that transmotion, the informations come to the gene inside the cell, and gene expression or gene activity will help to increase the heart rate and cardiac output. That is why when it is hyperthyroidism, that may cause the palpitations, right? আমাদের সময় অনেক সময় আসে হাতটা এরকম করে কাঁপছে, হ্যাঁ? So that is your may cause a thyrotoxicosis also. Palpitation is there, arrhythmia may occur, that may cause a arrhythmia also, right? So these things are very important for thyroid and clinical scenario, that if any patients with hyperthyroidism that may present with tachycardia and palpitation and also cause a ventricular tachycardia type of arrhythmia may happen. So that is important, and reverse can happen also. Reverse can happen, so if it is hypothyroidism that may cause the bradycardia and also it may also the arrhythmia also. তাহলে বেশি হলো arrhythmia হয়, কম হলো arrhythmia হয়. Arrhythmia is prevented by the if it is conduction process is very good, number 1. Number 2, যেটা এই ক্লাস আগের দুটো ক্লাসে বলেছিলাম, when we control the neural control, that is what they describe as a extracardiac and intracardiac, right? আমি বলেছিলাম, if you take the notes, extracardiac এর মধ্যে আমার পড়ছে sympathetic, parasympathetic and the medullary control. In the intracardiac, there is some ganglions are there, and they are interconnected, and that is not influenced by the brain at all. That is may influence in the sympathetic and parasympathetic chain, and that is why if any problem in the intercardiac chains or intercardiac ganglions or the surface of the heart, there is lots of ganglions are there, and then the arrhythmia can happen. So that's why all the arrhythmia cannot be corrected due to the lack of anatomical dysfunctions, right? কিছু লোক ওই নিয়ে বেঁচে আছে, পেসমেকার নিয়ে, এই নিয়ে সেই নিয়ে, ঠিক? So that's why arrhythmia can happen. Re-entry যদি আমি প্রিভেন্ট করতে না পারি, re-entry prevention কেন হবে, অলরেডি we explain that. That is your SA nodal যে conduction time and AV nodal conduction time is very big. হ্যাঁ, 1 meter per second, এটা হচ্ছে 0.1 meter per second. That is important. And SA নোড থেকে দুদিক থেকে যায়, SA নোডের থেকে দুদিক থেকে means ventricular দিকে আসবে, আবার AV নোডের দিকে আসবে, right? But from the AV node it is unidirectional. So if it is affects the unidirectional, that prevents the re-entry of the conduction to prevent the arrhythmia, right? Simple. আমি arrhythmiaতে যাবো না, already it is explained, because arrhythmia is a huge thing. Heart block, first degree, second degree, third degree heart blocks is a huge and very interesting and easy things are there. So hormonal controls already you know. So now you know already the neural control, the myogenic control, the hormonal or humoral control you already know, right? So if it comes in your examinations, এই যে control থেকে ছোট ছোট ভাবে অনেক কোশ্চেন কিন্তু দেবে, ছোট ছোট questions, right? So that is your part that you can say, কারণ এখনকার professional MBBS, now with the professional MBBS questions are coming from knowledge. If you don't know, no idea at all and concept, you have no, you can't pass at all. You can't pass. Can't pass. Whatever you write, if they read properly, you will fail. So conceptual questions is that important. And concept is that how it is happens, how is the supply, what are the receptors, how receptor acts, what is the receptor mediated actions are there. If you understand properly, one day you will realize that you know the physiology in a better way. And believe me, in Viva, in practical, very এই ক্লাসে অনেক টপ লেভেলে ক্লাস করা হয়, বাট ইন দ্য কোয়েশ্চেন্স ইন ভাইভা উইল বি ভেরি ফ্ল্যাট, ভেরি ফ্ল্যাট, যে সাপ্লাই প্যারাসিম্প্যাথেটিক হার্ট রেট বাড়ায় না কমায়। ইউ ক্যান বিলিভ দ্যাট ইউর সিনিয়র্স ক্যান নট এক্সপ্লেন দিস ওয়ান, ওরা প্যারাসিম্প্যাথেটিক নামই শোনেনি। সো ইট ভেরি আনফর্চুনেট দ্যাট দোজ স্টুডেন্টস উইল নট পাস অ্যাট অল as till I am here. Anyway, so next part of your cardiovascular system is very important, that is microcirculations. What do you mean by microcirculations? Any idea about that? Micro means what? Small? So small bed, the circulations is there, and this cardiovascular system understanding it happens on these microcirculations. What is ultimate aim? Ultimate aim, after the left ventricular contraction, the oxygenated and nutritional rich blood will reach into the different parts of the organs. Simple. But different organs e jawar age, that will enter into the microcirculations. There are lots of microcirculations are there. That is cerebral microcirculations. There is your coronary circulation. That is also a microcirculations. Not so much micro, that is cardiac microcirculations, pulmonary microcirculations, kidney microcirculations, right? So these things are important to understand, because if we ultimate aim of the cardiac contractility, cardiac output, blood pressure maintain, ultimate aim is what? Ultimate aim is to reach the fluid, your oxygen rich and nutrition rich food to the different tissues. Not only that, it collects in the waste product and also carbon dioxide into the venous system, and then comes into the right atrium, and then into the right ventricle, then into pulmonary circulation and pulmonary capillaries again. And then so the function of the capillaries are basically exchange. So that's very important, very important part is there. So to some extent I am like to understand that what is happening here, that if you understand the microcirculations, then you have to understand right heart and left heart separately. Suppose this is your কি বলবো, এটা হচ্ছে তোর right heart, right? It is your pulmonary trunk. এখান থেকে তোর superior vena cava, inferior vena cava has come. So there is your right atrium and right ventricle and the pulmonary trunk. কোনো confusion নেই? Very good. So now this is your lungs. This is your lungs, and also it is your, suppose this is your left ventricle, right? Left ventricle, and this is arch of aorta, and this is your descending aorta. বোঝা যাচ্ছে? Right ventricle, lungs, left ventricle, arch of aorta, and this is aorta. Suppose this is aorta, simple aorta, right? Now if it is right ventricle, deoxygenated blood enters into the lungs, and there is some alveoli, etc., and also pulmonary capillaries are there. There will be exchange, and then it comes as a pulmonary vein, then coming on down, okay, and then into the left ventricle, and the oxygenated blood then pump out, then throughout this one. এইবারেতে এই যে this is the your, suppose your descending aorta, and then it creates what? এখানে একটা দেবে, এখানে একটা দেবে, এরা কারা? And these are the organs, skeletal muscle, skin, brain, heart itself. So this is your supply. So what does it mean? Aorta, artery, arterioles. বোঝা যাচ্ছে? Aorta, these are your artery, and that will form again into your what? Arterioles, right? Arterioles. Then again it will meta-arterioles. So that is your aorta, artery, arterioles, meta-arterioles, and then the capillaries. Then your total capillary bed, right? That is your capillary bed. Sorry, এইটুকু অর্ধেকটা করব, right? That is your capillary bed is forming. suppose this is for your skin. Suppose this is your skin, and then you start venous. It is a capillary, and then ultimately it will enter into the vein. Vein-টা কোথায় ছিল? Vein-টা আমার এদিকে ছিল, right? So this is your vein. So ultimately connections are there. This is your capillary bed. This is your capillary bed. It is your venules. It is your, suppose it is right to shuru, then its veins are there. So what is happening here? It is schematic diagram, but understanding this is very important. So right heart, it enters right atrium, blood, right ventricle, pulmonary tongue, pulmonary circulation, then pulmonary veins, the pulmonary left atrium, left ventricle, and then ultimately এটাকে এইখানে করে দিই, এটা এইখানে হবে, that is left atrium, then left ventricle pump out the oxygenated blood and nutrition rich. This is nutrition rich, and that is coming down, right? Here pressure is 120, but here it will less. In this patient, up to this arteries, it may be 93, that is mean arterial pressure. But do you feel that the capillary, inside the capillary, the pressure will be 93? No. If you understand the, মনে করো একটা পাইপের মধ্যে জল গেছে, একটা দেখে থাকে ফুটো করতে গেছিস তুই, but do you think the force of water will same? Not at all. So that will decrease also, right? I'm coming. So ultimately structure of this one is like that ultimately it is artery, aorta, arterioles, meta-arterioles, capillaries, venules, veins, great veins, and big veins into the right atrium. So here it is, suppose this is your lung, skin tissue. Now what we are missing? So your input is your this one, and this is output. There is another output. কে বলতে পারবে? There is another important output. Yes, that is good one. That is a lymphatic drainage. So that is also lymph ducts will be there, and that will, you already know, that will drain into the great veins, right? So lymphatic also there. It's very important. So input is your one, that is arteriole, meta-arterioles, but output is venules as well as lymphatic duct. And lymphatic duct always it is connected here. Why so important here? I will say why it is so much important to here. So in this system, এই যে এইটা যদি বুঝে যাস, তাহলে মাইক্রোসার্কুলেশন বোঝা 50% 60% হয়ে গেল। যা কোশ্চেন আসুক এখান থেকে তুই বানিয়ে লিখে দিতে পারবি যে হোয়াট ইজ হ্যাপেনিং হিয়ার। দ্যাটস দ্য গ্রস আইডিয়া অফ মাইক্রোসার্কুলেশন অফ every organs, right? So this is your total anatomical as well as physiological funda will be there, right? Time খুব কম. So this is your skin. Suppose that may be your GI, that may be your splanchnic circulation, that may be your kidney tissue, whatever it may be. Ultimately there are some cells, that means tissues are there, right? And they will give off, কি দেবে? Oxygen দেবে, nutrition দেবে, that will depends upon the pressure, right? এইবারেতে আমি যদি ছোট্ট করে এখান থেকে এই সিস্টেমটাকে আমি এইখানে নিয়ে আসছি, রাইট? সাপোজ দিস ইজ ইয়োর ক্যাপিলারি, সেখান থেকে বেটার হচ্ছে এখানে একটা আর্টারিয়াল করে দিই, আর এটাকে আমি ভেনাসি রাখলাম সবুজ, ঠিক আছে? এটাকে রাখলাম। এইদিকে আমার এসেছে এখান থেকে মেটা আর্টারিয়ালস, আর এখান থেকে বেরিয়ে গেছে ভেনিউলস, রাইট? নাও already I told you that the mean arterial pressure is 93. You already know that. What is the formula of the mean arterial pressure? 1/3 of, you can say, pulse pressure. That is systolic BP minus diastolic BP. So that comes as a 93 approximately. So 93 millimeter of Hg is here, but not inside the capillary. It drops into কত? 35. But here it is not called as a blood pressure. It is called hydrostatic pressure. Jol, right? So this is your hydrostatic pressure, that is 35 millimeter of Hg in the arterial end, right? Now in the blood কি থাকে? Plasma protein, cells, আরবিসি, ডব্লিউবিসি যা বলবি, প্রোটিনের মধ্যে মেন কে অ্যালবুমিন, দ্যাট ইজ নেগেটিভলি চার্জড। সো দে আর ক্রিয়েট এ প্রেশার, দে উইল ক্রিয়েট এ pressure that is approximately suppose 20 millimeter of Hg, right? Why it is pressure? This is component is there, but each pressure is called colloidal osmotic pressure or oncotic pressure, right? So hydrostatic pressure is 35 and oncotic pressure is 20. Now your brain what is state? It will pull the water or push the water? 35 is a hydrostatic pressure. Hydrostatic pressure always push, and 20 is your pull, oncotic pressure. It pulls the water. So this is 35, it is 20. Push, very good. So here is the tissue cells. Cells are there, right? So now fluid will come into nearby arterial part. That is meant arterial end and is a venous end, right? Now এইটা যখন এই ব্লাডটা যখন যাবে, do you think the hydrostatic এ তো জল ছাড়ছে, so hydrostatic pressure will still remain in the venous part is 35? No. So that will come into suppose 10 to 15. And do you think that 20 millimeter of Hg oncotic pressure will remain same? এ তো কিছু বেরোচ্ছে না বাবা। So that will remain same. So that will 20. Now you tell me that is your pushing or pulling? That is your pulling. So that is your water again এখান থেকে আবার এখান থেকে যাবে। So that's the beauty of the capillaries. বোঝা যাচ্ছে? So pressure change is happening here, and so hydrostatic pressure and osmotic pressure, it comes from the osmosis, right? So these pressure changes is help to so that আমাদের স্কিনে দেখ কোনো এমনি ইডিমা হয়ে আছে নেই, but when you are in inflammations or any types of infection or any types of pressure changes will be there, so that will retain fluid in the interstitial space. এই টিস্যুগুলো কোথায় আছে? Interstitial space এ আছে. So these are the interstitial space. So fluid will come into this interstitial space and again it will enter into this. So keep it balanced so that edema does not happen. Number one, that is happening here. Now, to some extent, to some protein may come, very low proteins may come, small proteins, not big proteins may not come. That will come into your interstitium, and that's why this small protein can be go via this lymphatic system. That will go into the circulations and again reuse. So that protein cannot be lost. বোঝা যাচ্ছে? So the function of the albumin is to keep the water inside, right? Oncotic pressure. So keep the water inside. So prevent the edema. How it happens? Pressure changes. Pulling effect and the pushing effect. Simple, very very simple. When your 35 pressure is your osmotic BP is there, 20 is your oncotic pressure. So hydrostatic pressure is much more than the oncotic pressure. So water or fluids is pushing out. Now that 35 will be less because water is coming out. So that will come into 10 to 15. The half হয়ে যেতে পারে, and that will come 20 will be same. 20 remains same because protein very maximum fraction of protein may come, not always. So that maintained. So that is the pressure difference is there. So 20 is high. So that will pulling effect will be high. So that will be pulled again. So in this way, in this fashion, oxygen is delivering, nutrition is the delivery, and the waste products is coming out, and also carbon dioxide is coming out. বোঝা গেল? So this happens into your capillaries. Now you have to understand that what is the structure of capillaries. That's very important because there are three types of capillaries are there. There are 10 billion capillaries in our human body. 10 billion capillaries are there, and 10 to 100 capillaries নিয়ে এক একটা microcirculations হয়। কতগুলো বললাম? 10 to 100 capillaries নিয়ে microcirculations হয়। In doing the microcirculation, there is ultimately capillary pressure changes and exchange happening. Now capillary funda is very important to understand what are the three types of capillaries. There are three types of capillaries there. One is continuous, another is sinusoidal, another is fenestrated. Why it is important? Why it is so important? Because the function is different. কিডনিতে এক রকমের আমার ক্যাপিলারিজ থাকে, ব্রেনে এক রকম থাকে, ঠিক আছে, তারপরে বোনে এক রকম থাকে, আবার লিভার এক রকম থাকে। তো where it is essential, that's why God had gifted us or placement of that recruitment of that capillary type, right? Suppose bone marrow is regularly daily basis এ আমাদের ব্লাড সেল তৈরি করছে বোন ম্যারোতে। সো সেই বোন ম্যারোটা আমাদের ব্লাডে আসছে কিভাবে? আসছে এইভাবেই যে সেই নিশ্চয়ই ক্যাপিলারিতে আসছে, তারপর সিস্টেম সার্কুলেশনে আসছে। So that capillary should be sinusoidal. Now what do you mean by that sinusoidal? Sinusoidal part is what? What do you mean by sinusoidal? Suppose কি বলবো তোকে, this is your capillary bed endothelium. So capillary system is composed of single layer of endothelium and one basement membrane, right? So this is your basement membrane. And suppose another cells are there and there is a basement membrane, right? Now in case of sinusoidal type of capillaries, that inter-endothelium junction will be much more gap. এইখানে গ্যাপটা অনেক বেশি হবে, সেটা হচ্ছে সাইনোসয়েডাল। বোঝা যাচ্ছে? তাহলে endothelial gap will be much more. In case of fenestration, there will be pores over the endothelium, right? And also loose basement membrane. বোঝা যাচ্ছে? So they can porous. তাহলে fenestrated capillary কোথায় আছে বলে তোর মনে হয়? Glomerulus. Very, very good. So that is important. Exchange filtration will be much more better way. So that is important. And sinusoidal is present. One is bone marrow, other is already আমি পড়েছি যখন জিআই পড়েছি, নামটাও তো বল, লিভারে সাইনোসয়েডস পড়েছি। So sinusoidal capillaries are there in the liver. So lots of enzyme, lots of hormones, lots of metabolites are coming into the circulation in bigger way. তারা কি করছে না, এখানে সাইনোসয়েডাল মানে এখানে গ্যাপটা দিয়ে আমার চলে আসছে, গ্যাপ দিয়ে আমার এখান থেকে চলে আসবে। সো ক্যাপিলারি স্ট্রাকচার ইজ এন্ডোথেলিয়াম অ্যান্ড ওয়ান বেসমেন্ট মেমব্রেন। আর কন্টিনিউয়াস কি, কন্টিনিউয়াসের কোনো গ্যাপ ফ্যাপ কিছু নেই, দ্যার ইজ নো পোর, একটা সিম্পল এন্ডোথেলিয়াম অ্যাজ ওয়েল অ্যাজ এটা পুরো অ্যাটাচড অ্যান্ড এন্ডোথেলিয়াম মানে কি না, এরকম একটা এন্ডোথেলিয়াম আমি আঁকলাম, এটা এন্ডোথেলিয়াম লাগানো, আর এখানে একটা বেসমেন্ট মেমব্রেন। ইজ এ কন্টিনিউয়াস। কোথায় আছে? স্কিনে আছে। কোথায় আছে? লাংসে আছে। তারপর আমাদের ব্রেনে আছে। ওয়াই ইন দ্য ব্রেন নিডস আ কন্টিনিউয়াস টাইপ? বল দেখি কোথায় কন্টিনিউয়াস টাইপ ক্যাপিলারি আছে? ব্লাড ব্রেন ব্যারিয়ার। বোঝা যাচ্ছে? সো দ্যাট সব কিছু ব্রেনে যদি ঢুকে যেত তাতে মুশকিল হতো। সো দ্যাট ইজ প্রিভেন্টিভ। সো দ্যাটস ওয়াই দিস বিউটিফুল recruitment of our God is recruited that blood brain barrier as a continuous type of capillaries are there, right? So think about this, what is happening in your body, that will be interesting for your understanding and understanding in better way in the future, right? এইগুলো যদি না বুঝিস তাহলে পরবর্তীকালে মেডিসিন বুঝতে পারবি না, 100% sure, and that will not be helpful to be a good clinician. So these things are very important and this is helpful for your edema. এই যে পেশেন্টের জেনারেলিস্ট ইডিমা দেখছিস, একটা ছোট্ট কথা বলি, সাপোজ রাইট সাইডের হার্ট ফেলিওর হয়েছে, ইডিমা পাবি কি পাবি না? তুই এখন নিজেই বলে দিবি যে হ্যাঁ এটা স্যার হবে। দেখ কিভাবে বুঝবি, দেখ রাইট সাইডের হার্ট ফেলিওর ইজ দেয়ার। সো ইফ ইট ইজ ফেলিওর, so body pump cannot be around, so huge blood will be accumulated in this one. So ultimately it will backflow. Ultimately the pressure flow, backflow. So now this pressure was previously it was 10 to 15. Now it will increase around 40. বেড়ে যাবে। তার মানে কি হলো, ওখানে 20 আর এটা 40, তাহলে কি করবে? জল পুশিং, yes, that is interstitial pushing. Interstitial fluid will be pushed out. তখন আর এই ডিরেকশন থাকবে না বাবা, তখন এটা 40 হয়ে গেছে, and that will push and that is edema. So right heart failure may come as your pedal edema. বোঝা যাচ্ছে? সো একটা পেডাল ইডিমা দেখে আমরা যেমন কিডনি ভাবতে পারি যে কিডনির প্রবলেম, বা আমাকে এটাও ভাবতে হবে যে there is maybe some engrossment of the vessels and then pressure changes and that may come as edema. তাহলে বুঝতে পারছিস কোনো পেশেন্টস একটা ইডিমা নিয়ে এলে, এখানে যদি পেশেন্ট ইন কেস অফ এটা দেখবি ইডিমা এলেই আমরা কিন্তু ভাবছি যে হয় রেনাল কজ নাহলে কার্ডিওলজিক্যাল কজ। ইফ ইট ইজ রাইট সাইডে কনজেস্টেড ফেলিওর, then liver enlargement will be there. You know already that the liver will be enlarged because engrossment of the blood vessels গুলো ওখানে যাবে, তাহলে liver will be engrossed. So that is the edema is a cause of liver, heart cause, that is right heart failure. Right heart failure ultimately it goes into the left ventricular failure and then ultimately cor pulmonale. বোঝা যাচ্ছে? So in these patients it will come in medicines. It's very huge chapters are there. So these things are very much important to understanding what is happening here, how and why the osmotic and as well as hydrostatic pressure is important for the capillary level. বোঝা গেল? So 3 types of capillaries are there. Remember that. Position I already explained. Not only that, suppose your new cells of bone is coming into the sinusoidal pattern. Sinusoidal capillary means the gap of interendothelium layer, right? Now you can say that how the process is happening for the মানে এই দিক দিয়ে কি করে এগুলো পাস হচ্ছে, right? That is depends upon the two process. One is transcytosis, another is vesicular channels, right? What are those? Transcytosis means what? মানে হচ্ছে এইখানে মনে কর কোনো জিনিস আছে, সেইটাকে এখানে একটা পিট তৈরি করছে, এটা কোটেড পিট, and that creates a vesicle, right? So endocytosis, and then again it is causing the exocytosis throughout the endothelium, single layer. That may be protein, that may be many fluids, etc. that is coming out into this interstitial space. That is called transcytosis. And এই ভ্যাকুলস গুলো এখানে তৈরি হয়েছে, নিয়ে তারা কি করেছে, তারা এইটাকে একত্রিত করে একটা চ্যানেলে তৈরি করে দিয়েছে, that is called vesicular channels. So that will also come. So in these two process, that is transcytosis and vesicular channels, the proteins or fluid can enter from the endothelium to the interstitial space. Simple. এইটা যদি পড়তে পারিস বা বুঝতে পারিস, that is important for your, not only for your exam, it is also important for your understanding total cardiovascular system. Cardiovascular system কে ultimately successfully বুঝলি নাকি জানতে গেলে microcirculation important, right? So lots of microcirculations are there. It is a homework. There's a fetal circulation, splanchnic circulations, renal microcirculations. All the microcirculations are important. তার মধ্যে fetal circulation তোদের সিলেবাসে আছে, সময় পেলে পরের দিনকে পড়িয়ে দেবো, right? So these things are very important. If any query you have, এটা মুছে দিস রে বাবু, এটা মুছে দিস. So if any query you can say what is the problem, etc. So now today's class is your humoral part of control of your cardiac cycle, that is already explained, and now this is a microcirculation as well as structure of the capillaries and how the edema occurs and how we can prevent the edema and how the blood pressure is changing into the osmotic pressure, hydrostatic pressure is changes, depends on this one is the formation of your edema or prevention of your edema. So if your albumin is low, that means your 20 pressure টা থাকবে না, right? তাহলে আমি যদি লিভার থেকে অ্যালবুমিন তৈরি করতে না পারি, তাহলে that 20 pressure may come into the less, right? যখন এটা কম হয়ে যায়, যদি 20 হয়ে যায় তাহলে 35 ওখানে 10 হয়ে গেছে, right? Then lots of fluids will enter. Not only that, this will also push করতে পারবে না, so that entering and accumulating the fluid, and that is called your edema. So edema is your important part, and why and how it is examined clinically I already explained in my class. যারা আমার ক্লাস করেছিস, two sites are there. One is medial malleolar 1.5 to 2 cm above, press the 30 seconds and then see what is the pitting or not. Another is your sacrum, right? If it is problem is there in leg, so you can press the sacrum for again same thing, it's 30 seconds, then see the edema is present or not. So edema is very very important. If any patient having simple fever, etc., that may also come also as a edema, because impending heart failure, impending infection, because the capillary pressure changes and the endothelial changes, the permeability is also altered by the different cytokines, prostaglandin, bradykinin, etc. That means inflammatory markers. So any inflammation, আগেও বলেছি, inflammation যে ভালো করে পড়বি will be a very good clinician. So inflammation হলে এখান থেকে লিকেজ হবে and that will create the edema. Only the medication may come as edema with the heart failure, renal failure, etc.